Bismillahirrahmanirrahim. Today we will discuss about the Norma basalis for viva purpose. Now here you can see this is the inferior view of the skull, and that is called Norma basalis. Now for study purpose we divided Norma basalis into three parts. This one is the anterior part where there is the hard palate, and then we pass like this an imaginary line in front of anterior margin of foramina magnum, and we divide the this part into middle area, and this one is the posterior area. And then we will study the anterior part. Now this is the anterior part. In anterior part anteriorly there is alveolar process which provides sockets for the upper teeth. Then here you can see hard palate. Now we will see the formation of hard palate. Now anterior 2/3 is formed by palatine process of maxilla. Posterior 1/3 is formed by horizontal plate of palatine bone. Now between them there is a cruciform suture like this, and parts of the suture are, this one is the intermaxillary suture, this one is the interpalatine suture, this one is the palatomaxillary suture. Now other features are, here you can see incisive fossa, incisive canal. Then behind this palatomaxillary suture, this foramina is the greater palatine foramina, and behind the greater palatine foramina, this foramina is the lesser palatine foramina. Now behind the greater palatine foramina, this crest is the palatine crest that runs medially. Now this is the posterior border of the free border of the hard palate, and here you can see this is the posterior nasal spine. So it was the anterior part. Then this one is the middle part. Now middle part is further divided into median area and lateral area. In the median area, first of all you will see the vomer. This one is the vomer, and here is the posterior border of the vomer. Now when we will see in anatomical position, its lower border articulate with the hard palate, and its upper border makes two ala. These are the two ala. Now here by the overlapping of bones there are formation of two canals. Here are the vomerovaginal canals, and here are the palatinovaginal canals. Now these are the two nasal aperture, posterior nasal apertures, that are divided by the vomer. Then posteriorly, this one is the broad bar of bone. This broad bar of bone is formed anteriorly by the body of sphenoid bone, and posteriorly by the basilar part of occipital bone. Now on the broad bar, here is the pharyngeal tubercle for the attachment of pharynx. Then laterally bones are the sphenoid bone, and greater wing of sphenoid bone, infratemporal surface, petrous part of temporal bone, and here you will see the tympanic plate and squamous part of the temporal bone. Now first of all we will discuss about the pterygoid process. This one is the pterygoid process. Now pterygoid process has two plates. This one is the medial pterygoid plate, this one is the lateral pterygoid plate. Now each plate has two surfaces. This is the medial surface of the medial pterygoid plate, this surface is the lateral surface of the medial pterygoid plate. Now this is lateral pterygoid plate, and this is the medial surface of the lateral pterygoid plate, and this one is the lateral surface of the lateral pterygoid plate. Now these are the posterior free borders of the plates, and anteriorly on the medial side they meet with the perpendicular plate of palatine bone, and on the lateral side it is separated from this maxilla by pterygomaxillary fissure. This one is the pterygomaxillary fissure. Now between the medial and lateral pterygoid plate, this fossa is the pterygoid fossa. Now posterior border of the medial pterygoid plate in its lower end is projected, and here is the pterygoid humulus. This part is known as pterygoid humulus, and its upper end enclose the scaphoid fossa. This fossa is the scaphoid fossa. Then laterally here you can see great infratemporal surface of the greater wing of sphenoid bone, and on this there is a crest. This is the infratemporal crest. Now we will see different foraminas. Here you can see this is the foramina ovale, this one is the foramina spinosum. Behind the spinosum, this spine is the spine of sphenoid. Now medially this foramina is the foramina lacerum, and this is the carotid canal that makes a tunnel here and opens into this foramina lacerum. Now between the lacerum and ovale, this sulcus like structure is the sulcus tubi that lodges the cartilaginous part of the auditory tube. Then behind, this is the tympanic plate, and this one is the styloid process. And here you can see this is the mandibular fossa for the head of mandible. Now in the posterior part, this one is the posterior part. Now occipital bone has three parts: basilar part, squamous part, and condylar part. Now in the posterior part, in the median area, you will see first of all foramina magnum. Now behind the foramina magnum, this crest is the external occipital crest that ends into external occipital protuberance. This is the external occipital protuberance. Now from protuberance on each side there are two superior knuckle lines, and here are the two inferior knuckle lines. Now this is the condylar part of the occipital bone. Now here these are the two occipital condyles on each side of the foramina magnum. Now see that anterior to the occipital condyle, this canal is the anterior condylar canal, that is known as hypoglossal canal, and here is the posterior condylar canal, and this fossa is the condylar fossa. Now lateral to the occipital condyles, this process is the jugular process. This one and this one are the jugular process. Now anterior to the jugular process, this foramina, large foramina, is the foramina, jugular foramina. Now jugular foramina, this part is known as jugular fossa, that lodges the superior bulb of the internal jugular bone, internal jugular vein. And now the anterior margin of the jugular process, this margin is known as jugular notch. Now in this part you will see the styloid process. Behind the styloid process, this one is the mastoid process, and between the styloid process and mastoid process, this foramina is the stylomastoid foramina. Now this notch is the mastoid notch, and this is the groove for the occipital artery. So it was all about the Norma basalis.